Welcome back to another episode of What's the Word, an electrical industry podcast. I am your host, Zach Hartle, and I am joined, as always, by Jason Cox. We're very excited for our episode today. Jason, who do we have on the show today?
Our guest today, Zach, is Neil Moffatt. Neil is the Director of Health, Safety, and Environment at Canem Systems Limited. He's the Vice President of the Electrical Contractors Association Executive Board. He's the presiding officer of the Alberta Provincial Apprenticeship Committee. He's the past chair of the Alberta Construction Safety Association. He's got a gold seal, and he's a National Construction Safety Officer.
That is quite the list of credentials, and I couldn't think of anyone more qualified to be here today to talk about COVID. So, we're right in the middle of a fourth wave. We just want to get into a little bit about how a company such as Canem Systems or any electrical contractor operates through COVID and how COVID is going to affect things and change their operations. So I guess with that, let's jump into our episode.
Today, we're joined by Neil Moffatt. Neil, welcome to What's the Word?
Okay, thanks for having me, Jason.
Neil, you've been involved in the electrical industry for over 35 years now. Your area of expertise is safety. How has workplace safety changed over the last decade?
Well, it's certainly moving forward, starting to look at different ways of recognizing and identifying hazards. Certainly, an individual or a company's safety record certainly has a much more significant part to play in their ability to win projects than it was 15, 20 years ago. There's certificate of recognition programs that are out there across all of the different provinces. Alberta is certainly not an exception. And so it's about ongoing, continuous improvement and, looking for better ways to educate people on how to recognize and mitigate the hazards that they do come across on a daily basis.
So part of my next question would be, have the attitudes changed over the last 10 years? And I think you've already answered part of that. So it sounds like your customers are taking safety into account when they're looking for contractors.
Most definitely. Like everything else, it has to have an impetus. And certainly clients are much more demanding now than they were before. I think you see more of a difference now between a public company versus a private company in terms of what some of their expectations might be that they're looking for. So for sure, those attitudes have changed on the front end, and that's all the part that leads into whether or not you're successful in getting a job, right? I think the other piece of the puzzle, a very important piece of the puzzle, is the individual attitude of workers on the job sites. And certainly in the last 10 to 15 years, there's been a big change there as well. I think that it's pretty commonplace now to see things like mandatory glove programs, mandatory eye protection programs, that type of thing. You didn't see those 20, 25 years ago. You see them now. A lot of the, and I think that the attitude of the attitudes and the expectations of the younger generations that are making their way in the industry has changed as well. I think that society has done a pretty good job of bringing safety forward as a number one concern for people in their daily lives. So I think younger people now have a higher expectation of the ability to be able to work in a safe environment than they did 20, 25 years ago.
Excellent. Yeah, that really answers. That was the second part of my question, was have the attitude changed with the workers too? And very interesting, the comment of working for a public versus private contractor. That obviously everyone is accountable, but when you're a publicly traded company, that makes sense as well.
Yeah, well, a publicly traded company is basically gets the direction from a board. And certainly, these boards and the people that are on these boards, their number one motive, their number one driver is to, ensure that the business has in place the things that will protect the best interests of that business and position it for growth and continued success.
Neil, so one of the main reasons we wanted to have you on the show today, obviously you're a wealth of knowledge, having so much expertise in safety within the trade. But we're in the middle of a fourth wave here. Hopefully it's on the downturn, but COVID's obviously been one of the biggest challenges you've seen in your role. So maybe can you just talk a little bit about how you operate during a pandemic, how it really changed your day-to-day thinking on safety? And we'll kind of start with that, and I'm sure we'll branch off into many more aspects of it.
Yeah, like in terms of, did attitudes change in regards to day-to-day safety expectations or, just general attitudes? I don't think that COVID really has had much effect on that, overall attitude. Most definitely, COVID has created the opportunity to and the need to have certain things taken care of or evaluated in order to continue to operate. The construction industry as a whole, across the country and certainly in all the provinces, has done an amazing job of keeping the lights on, keeping the keeping the power on, keeping the work going. Construction was fortunate enough to be deemed an essential service. So that certainly provided the opportunity for construction workers to continue to work. But most definitely, the part that has changed is what you have to do on a job site to be able to continue to work in a COVID world. So it hasn't been so much, polishing up, old ideas or old attitudes or that type of thing. It's been about understanding that COVID means that we need to do things differently. We have to assess, we have to have a closer look at if and when our people are working in close proximity to one another. And if they are, then how can they protect themselves? And if they can't protect themselves, then the opportunity is to revisit how are you actually getting some of those tasks done. So I think that in terms of how do you do things differently, COVID has provided the opportunity for people to look at how they might go about getting everyday tasks done. Certainly the other piece of the puzzle, has been around, how do people interact on that job site? So, the old days or, typical construction site would be, one site office and one site lunchroom with a consistent lunchtime. What COVID has done is it's forced people to look at things like staggered break times, staggered lunch times. In fact, maybe even doubling or tripling the number of break rooms that you might have available on the job site, just so that you can, allow people the opportunity to take their breaks and take their lunch in an environment where, they can take their coats off and, take their masks off and relax for 15 or 30 minutes and have some lunch, but do so in an environment that is protected. So, we've got examples of lunchrooms that have barriers around individual tables, barriers between individual, lunch stations or that type of thing. So certainly those changes have been the big ones. I think that along with that, you still, I would say for sure that when it first started, everything needed to slow down because you had to stop doing things the way you were doing it before. So for the first little bit, there was most definitely, I would say, a heightened level of awareness in slowing down and being aware of what the right way to do things was. And it might take you a little bit longer to get stuff done. Once people got kind of comfortable with that, then things started to kind of get back to a normal or a COVID normal. There's no such thing as normal anymore, but there is a COVID normal. So
Yeah, one thing you said there that I don't know, resonates with me is that it's an opportunity, right? COVID is an opportunity. At no point is it a challenge or a barrier. It's just an opportunity to, like you say, even assess some of your older safety policies and bring them in line, right? Really assess the day-to-day operations of a site. So I don't know, using it as an opportunity, I think, is a great way to look at it.
yeah, for sure. And I think that, people that have been successful with how they've been able to function through COVID is probably due in large part because of maybe that little bit of a shift in attitude or that type of thing, to try and focus on, spending your time thinking about and talking about how can we do this safely? How can we improve on this? As opposed to, spending the time complaining about the fact that we have to do something different because there's this virus out there that, we really don't know that much about.
So Neil, in your position right now, you oversee work done in multiple provinces. How is it that you are getting your message out to your field staff throughout multiple provinces?
Well, we have safety coordinators in each one of our major branches or major areas. So in terms of a conduit, that's been the conduit that we've used. But if you go back to how did we decide what the message was going to be or what the COVID procedures were going to be? At the beginning, that was a really big struggle. Because we do operate in 5 provinces. And right off the get-go, there were differences in the provinces in terms of isolation and symptoms and, the whole reporting of COVID and, websites and that type of thing. So what we did early on in the get-go was we used the Public Health Agency of Canada guidelines for the most part to be able to identify, say, items like the symptoms that we were going to be looking for, on our COVID questionnaires and that type of thing. We looked at, the differences in the provinces in terms of, days of isolation that might be required or anything else like that. And for the most part, we looked for opportunities to be able to apply the most stringent or the highest level of what some of those standards were. So, there was a little bit of an education process. Let's just say, for example, maybe if somebody in BC was looking at, the number of days that you would have to be in isolation versus the number of days in Alberta. Well, from the get-go, the numbers were different. So, when we did settle on the higher number, you got some people in some provinces that, they might have said, well, okay, well, why do we have to do this? Well, at the end of the day, the reason the driving force behind everything that we have done with COVID has been about making sure that we're doing everything that is reasonably possible to protect the health of our people. So if that means that we're applying a higher standard to people in Manitoba than what the Manitoba government would say, well, so be it. But at the end of the day, we wanted to make sure that we were applying a standard that would provide the greatest level of support and or protection to our people across the country. And then we communicated that. We put together a safe job procedure that at last count, I think we're on the 9th revision of that safe job procedure. It's been an ongoing living, breathing document. And that is how we have been able to spread the message on what is required.
I think it's all about information, and it's frustrating because it is changing constantly. And I mean, like you said, you're dealing with 5 provinces and 5 different best practices. So yeah, communication would be key to your staff for sure.
Yeah, I think that, and if you talk about communication, I think that probably the biggest problem, the biggest concern that COVID has caused is it has basically pitted people against one another, because everybody watches the news, they read the paper, they're reading the tweets, they're doing all this stuff, they're becoming educated, and then there's the conversations, and it's all about what individuals' interpretations of the regulations or the restrictions are. So it's been difficult on all of us, I think, because it's a very personal thing. I mean, even right now, vaccination is at the end of the day, it's a personal choice. You either believe in it or you don't believe in it, and you're either going to do it or you're not going to do it. So I think that's the biggest problem. Very early on, we developed a process whereby we had individuals identified in each region as a designated tracker, and their job basically was to gather information from people that weren't coming to work because they were exhibiting symptoms, whether or not they needed testing or that type of thing, and then interpreting and communicating with those folks on what their length of isolation might be, or what the next step forward might be, or what the next requirement might be. So early on, we set up a process whereby we had all of these discussions around COVID isolations and positive, negative, and that kind of thing. All of that stuff was being funneled through one individual in a region. And what that allowed us to do was to be able to do as good a job as we possibly could in ensuring that the message that everybody heard on March the 16th, 2020 was still the same message that they might be hearing a year later. So a level of consistency, but by having that designated person in each region who was responsible to gather this information and speak with the workers, it put us in a position of making sure that the information that we were putting out there was consistent, so that people heard the same thing from Canem.
Yeah, that's a great point. And there's no question that having that consistent voice and person to go to can be so helpful for everyone, right? Especially during the stresses of the pandemic, with so much misinformation out there or conflicting information. Now, as we're kind of shifting modes from a restriction lockdown into more vaccinations and, less restrictions, how are you guys pivoting with all that information now?
Right now, the conversation is all about understanding what client, owner, and maybe some general contractors, what their requirements are in terms of vaccination and testing, whether they're going to allow it, what type, is it an accommodation or what have you. So that right now the conversation has changed certainly at a level in the companies, because you've got clients that are, sending out letters and saying, okay, well, this is our mandatory vaccination requirement as of such and such a date. So, we want you to sign off on this. But then at the end of the day, as an individual contractor, now it's put us into the position of needing to develop processes so that we can make people aware of what the requirements are to access a certain site. And in some cases, we might even have to maybe not dispatch somebody to a site because we know, or we're told that they can't meet those vaccination requirements. So certainly in the last month, that has been the focus of the conversation throughout the industry. And it's just kind of it's reframing the conversation around, okay, what do we have to do to actually be able to go in there and do some work? And then once we get there, at the end of the day, we're still surviving on the job sites within the same, close proximity rules, distancing as much as possible, assessing the health of people on a daily basis. You still have the daily health questionnaires for people to get on sites and that type of thing. But the conversation has definitely changed now, where the requirement is for you as a company owner or as a company officer to sign off and basically sign a declaration saying that your people will meet that client's vaccination requirements prior to dispatching into the site.
Neil, it seems like the behavior of work tasks and how you would do a job now has to be considered when we're dealing with COVID. I would imagine the COVID PPE, wearing a mask and keeping your hands, gloves, sanitized is not a problem. How has your response been from your staff regarding wearing the PPE and following the standards for hygiene?
I think that overall it's been pretty good. I think that early on, people definitely struggled because it was something new that needed to happen, especially with the wearing of a mask. I mean, the only other, usually the only time you wear a mask is when you're in you're in an environment that has some concerns about oxygen availability or quality of the air or that type of thing. But so certainly people had some struggles with different types of masks, and what that did to them in terms of being able to breathe. But actually, more importantly, we ended up finding that a lot of people were having issues with safety glasses fogging up. So we actually, had to, took a little bit of time for us to find, the type glasses or the types of glasses or different types of sprays that would limit or eliminate the fogging of the eyewear while you were wearing the mask. So that was definitely a bit of a changer, and it definitely, caused some concern for people. I think that you did, whereas you might have expected to see somebody wearing their glasses 20, 7 out of the 8 hours they were on the job site. Well, with COVID, I think that anytime there was an opportunity to take them off or to slip the mask down is something that people would do. But certainly if you were ever in close proximity with people, you got to keep those things on. And then it's a matter of, okay, is this the right, look at all the discussions about what the right types of masks were. At the end of the day, there was 2-ply, 3-ply, this, that, and everything else. So, at the end of the day, with this particular virus here, as long as you can, control those airborne particles, you're doing something, right? So.
And like you were saying, our industry is very fortunate that it was able to continue to work during COVID, right? There was other industries that were shut down. So I think eventually that gets to everyone's kind of perspective. We kind of see just how fortunate we are that we can continue to work, and
Mhm.
then obviously compliance with the safety equipment, whether it's the mask or hygiene. I mean, it just makes sense as far as, hey, you're still trying to make a paycheck.
Yeah, and you know what? I mean, I think that in terms of the benefit, or should people have been working? I mean, there are a lot of people that were affected by COVID in a negative manner when it came to their employment. Some people lost their jobs completely. I mean, in construction, at least we were able to to maintain that and keep that going. And I mean, the construction industry as a whole, certainly not just us, but as a whole, across all the different trades and all the different disciplines and stuff like that. I mean, I think that we have to tip our hats off to the folks that, were, supervisors and leaders and workers in those companies, because at the end of the day, throughout this 20 months of COVID that has been, um, I think that you could make a case that the safest place for somebody was at work, because at work, in order for you to keep working, you had to have specific processes or protocols in place. Outside of work, it's pretty easy to let your guard down, and do some stuff that, or maybe outside of the restrictions, or maybe not, or, maybe just let your guard down a little bit. So, I think that at the end of the day, our experience throughout COVID, I think that we might have identified one particular instance where the virus itself was maybe contracted or transmitted from the site. Everything else was coming from off-site into the job site. So, but I mean, that's not exactly 100% either, because you could have that argument for forever trying to determine where something might have actually transmitted from.
Yeah, that the tracing of the source of the virus is something that, I mean, we'll never get 100% for sure. When that does happen, when there is confirmed cases on sites, I mean, I'm sure it shifted a little bit throughout the pandemic, but how were outbreaks or transmissions on a site or brought in from a site, how are those dealt with?
Again, I mentioned earlier that we had set up every region with a what we called a designated tracker, and that person was basically the record keeper and the guidance provider, the resource person for people on job sites to let us know what was going on in regards to COVID and people having symptoms or that type of thing. So what we found, we were basically doing our own contact tracing. So if you have an individual who woke up on Monday morning and not feeling well, phones into the supervisor and says, you know what, I'm not feeling well today. I got a cough, I got a runny nose, I got a bit of a fever. That person would immediately then be in contact with the designated tracker, and the designated tracker would, capture their information and, log it, and then, kind of go from there. Provide direction on whether or not a test would be appropriate or not. Certainly there's far less testing going on now than there has been over the past year, just because of the nature of vaccinations and a certain percentage of people being vaccinated. There's not as much testing going on now. But if you looked at so what happened when somebody tested positive? So if somebody tests positive, then we would have already been in contact with them in most cases. For people that were asymptomatic and then testing positive, certainly the positive test would be the first time that we would be aware of what was going on. But because we were doing our own contact tracing and stuff like that, then we would then be trying to understand whether or not people had close contacts or not, who they were, what areas of a job site they worked in on certain days. And then we would let their coworkers know and say, okay, just to let you know, a coworker of yours has tested positive. It appears that you might have been in close contact with him over the last couple of days or whatever. Monitor yourself. You either you've got to isolate right away because that's the way that it kind of used to be. And now that isolation has kind of gone away for a close contact. But and I'm probably doing a really crappy job of explaining how we did our own contact tracing, but in large part because of what we were doing and gathering information at a rate that was far quicker than any of the other provincial contact tracing authorities could do. And on numerous occasions from all of the different provincial health authorities that we were dealing with, when we got into situations where we needed to speak with them, they were very, very impressed and very, very, very satisfied and pleased to hear that the contact tracing that we were doing of our own was in itself very, very complete and made their job an awful lot easier as well.
That phone call to the foreman in the morning, feeling a little bit sick, that's a much different phone call today than it was 10 years ago, because 10 years ago would have been a come to work. But
and you know what, Zach, I mean, you're absolutely bang on there, because that is one of the things that, early on needed to start changing. And it's that attitude about people calling in sick. And, and whether or not you're talking about, the hourly guy working on the job site, or whether you're talking about the salaried person working in the office, there's no doubt that, we had a pretty proud history of, showing up to work every day, or, and maybe a little bit of a cough or a little bit of this or whatever. But on the flip side of that, there's an awful lot of supervisors and bosses out there that, kind of, had the attitude that, really, you're sick again, or that type of thing. Well, that has had to change, and we had to let supervisors know that the message that we were communicating to our people, whether they were hourly or staff, it didn't really matter, was, what, the game has changed. If you're not feeling well, stay home, call in, let us know. If appropriate, then we'll put you in contact with the designated tracker, and then we're going to follow this through so that you get the right type of help or the right number of days or whatever that you can, feel better. So it's about removing that stigma that associated with, oh, sick again. Okay.
Yeah, the power through, get her done, no matter what it take days are clearly coming to an end.
Neil, is there any process or procedure that you guys have picked up during COVID that you guys would probably continue to use moving forward, hopefully after the COVID crisis is over?
I think that we are definitely going to start looking at how we get jobs done or how we assign tasks differently, because we've seen that some tasks that we might have gotten used to having more than one person do them, maybe only one person needs to do them. So I think that some of those types of attitudes or those types of work changes in work processes are probably going to be the ones that will change. I'm really hopeful that at some point in time we will be able to stop producing proof of vaccination or a vaccine passport. I mean, right now there seems to be about 10 or 12 of those things out there. So I would like to think that at some point we'll get past that. But I do think that the opportunity to have a look at how we're getting the work done is going to change. And maybe more so in the, in the administration or in the company salaried staff type of thing. COVID has presented an opportunity for people to take a really hard look at the work processes that they do have and whether or not those work processes or those work functions have to be performed by somebody in a physical space in an office as opposed to working from home. And again, I throw it out there as the opportunity because that's the way to kind of have a look at it. But I do think that you're going to see people make some changes in how they do that and identify different types of roles that don't necessarily need to be performed by somebody occupying a 12 by 12 office in an industrial park somewhere. So I think that you're going to see a little bit of I think you'll see some companies that will have more of their work functions conducted remotely.
Neil, is there a significant difference in how you guys are treating COVID, looking at the perspective of your workers going in on a massive construction site, and then also your workers maybe in a service van going into an establishment?
I think that the only difference would really be on the scale of what is in place, whether it was a large construction site or a small service site, customers building or whatever. There would be either a paper questionnaire that would have to be completed or some kind of an electronic version that would be more applicable in a large case scenario.
And so is that slowing down the process for workers to get into big job sites, or is it a pretty quick process?
For the most part, it's a very quick process. It's certainly quicker now than it was when it was first brought in. I mentioned earlier that, we had to look at things like staggering lunch times, staggering break times. We also had to look at things like staggering break times, especially on the larger sites, so that you didn't have everybody showing up at the same time. If as a larger site like the cancer center, we had, a couple hundred people there. Well, you can't, maybe you only have 80 of them showing up at one time, and then another 80, and then another 80, and then another 80. So those were changes that needed to be made.
And on those big job sites, when you're coming in the gates in the morning, was the general contractor the one that was kind of looking at each of the contractors, or did you guys kind of take care of your trade? Plumbers took care of their trade?
On the larger job sites where somebody has been designated as the prime contractor, then they were the ones that were doing that, because they're in control. As the prime contractor, they're in control and responsible for the site for the client.
Excellent.
Neil, thanks so much for coming and chatting with us here about COVID. And I mean, I'm sure it's been a hectic and busy 20-ish months for you now. So really appreciate you taking the time just to come share with us and the few people who are listening here, your experiences and how it's affected your work. So we appreciate it.
Yeah. Thank you for the opportunity to speak with you.
Thanks so much to everyone for listening in on our conversation with Neil Moffatt. We thought it was a pretty timely episode to get in some experience in dealing with COVID out there in the industry. And I definitely learned a lot. And Jason, I'm wondering, what are some of your takeaways from the show?
One of the takeaways I got from that episode, Zach, was that Neil's company was working with the 5 provinces with their health boards for the contact tracing. So it was interesting to see that their initiative to keep their staff working actually benefited the contact tracers and each of the provinces health departments.
Yeah, I love to hear that too, how that little bit of initiative kept that clear message for all their employees, right? Employees spread out over 5 provinces, getting that clear message right now is just, without a doubt, one of the most important things, right? To avoid that misinformation and confusion. So I was glad to hear about that. Also glad to say that Neil is likely going to come back on the show to talk a little bit more about the Provincial Apprenticeship Committee, or actually what it will soon be called once the dust settles on Bill 67, some new legislation passed here in Alberta, which has huge overarching changes to the electrical trade and apprenticeship training as a whole. So I'm really excited to have him back to chat about that.
Yeah, Zach, this Bill 67, it's going to be a game changer. That's what everyone keeps telling us. So when the dust settles, Neil is exactly the kind of person we're looking for in our episode. He's passionate about the industry. He's been volunteering with our industry for years. And I think it'd be very interesting to see when the bill is adopted, just what changes those are going to have on apprenticeship and especially the electrical trade.
Absolutely. And you know what? I think that's everything we have for this week. So I just want to thank everybody who came to listen today. We are so glad to have you. Please share the show with a friend. Let them know if you like it. Of course, you know you can find it anywhere you listen to podcasts, Apple, Spotify, Google. Leave us a review. Let us know what you think. And as always, keep yourself safe out there. And if you can, someone else too.